What is Vida? How did it get there? Where do you want to see it go?
We just have something really special to offer that isn't around, which is great. And that's that team approach to care where people come in for massage, acupuncture, chiropractic, functional medicine, or physical therapy, but they find their team. The team approach is not something I created. This isn't every single locker room of every single sports team.
Those who are unfamiliar with chiropractic and have perhaps never seen a chiropractor, can you just define a little bit more about what manipulation is?
It's a great question. Manipulation is to the joints. People think the bone, but it's the joints. We were really good at pain, muscle pain, back pain, foot pain, ankle pain, rehabilitation after surgery, exercise. We had it dialed. We had our system dialed in there. Just that primary care was missing. A lot of functional medicine specialists just specialize in one thing, guts or women's health. That's it. So they're going to be missing other components possibly in there. So when we talk about primary care, it's like it's all encompassing. You have to really understand the psychology of this patient, their whole history. So it's hard not to be a really good functional medicine specialist, I think, in my opinion, without being their primary care.
Hi, I'm Dr. Michelle Leary. I'm host of the new Vida Vitality Podcast. We're so excited to bring this to you. It's been in the works for multiple years. This is a way for our doctors, guests, people who are experts in their field to then bring real-time information on what they're reading, what they're talking to their patients about, what they're passionate about, and translate that information directly to you. Today, I'm so excited to bring Dr. Kris Sasaki, who is one of our founders, CEO of Vida Integrated Health. He has an amazing background, not only in chiropractic medicine, but also in business. He's had businesses all over the world, so he's going to talk to us today about his vision and how we can learn a little bit about how Vida got started and what we're here to talk about. Thanks for being here.
Thank you for having me.
Yeah, absolutely. Can you talk to us a little bit about your personal health journey and just how you thought about in starting Vida right from the get-go, and what are your roots?
Where did I start?
Yeah.
When I say that, it's why did I get into healthcare?
Yeah, exactly.
First, I guess it was an injury. When I was a high school athlete, I hurt my wrist. I had I'm Canadian, so it was a provincial championship match that I had in basketball. And I went to actually a physical therapist, and they actually rehabilitated my wrists and got them ready. But one of the techniques they used was manipulation. And I couldn't move my wrist, but this doc grabbed my wrist and just cavitated. It cavitated and made loud pops, and it didn't hurt at all. And then I had a lot of mobility back in my wrist. That fascinated me, of course, as a 16-year-old kid. And then he used lasers, he used PT stuff to get me back, taped me up, got me onto the court, and that started my career. That started my vision into PT, chiropractic. So I followed around a chiropractor and I just fell in love with it. That was my passion for many years, was chiropractic. And so I whipped through my undergrad of kinesiology at University of Victoria in Canada, and then went to Portland, Oregon, and got my degree there. I came out of school very young, at 23 years old.
Wow.
So
a baby.
I was a baby. I haven't traveled anywhere, done anything. So I didn't want to set up shop in my hometown, Vancouver, Canada. And so I decided to go to Peru, actually.
Oh, Peru.
I went there for 2 weeks to do a locum, which is, I'm just covering a doc that's going on vacation. And that opened my eyes to another world of healthcare and chiropractic. And there wasn't many chiropractors in Peru, obviously. I didn't speak the language, so I had to translate the whole time. And it just felt shady, is a good way to say it. And as a young 23-year-old coming out of school as a valedictorian, I knew everything. I knew everything that could happen. And it just didn't sit well. It didn't sit so well that I decided, I came home and I said, actually, I'm going to move to Peru.
And so it was because you felt like you could do it better?
I wanted to bring what I felt chiropractic was to the community there, which is true musculoskeletal care and guidance, not just manipulation or cracking and popping and a different philosophy of care is what I was trying to bring.
Which, if I can just use my own kind of prior bias, because I'm not a chiropractor and didn't have as much exposure to the chiropractic profession prior to being at Vida, there is quite a bit of a stereotype around chiropractors and just doing a lot of manipulation, rushing through. So it sounds like you saw something, you wanted to do it differently in this community that you had very limited exposure to. So talk to me about that decision.
Yeah, so there's so many different spectrums of chiropractic. So there's two alleys, right? There's the philosophical alley where it's like manipulation is so strong, adjustments are so strong that you can get 70% of people better just by manipulating, getting them moving, and getting their joints functioning properly. But then there's the sort of healthcare MSK structural stuff. When I say that, like really understanding the biomechanics, the soft tissue, the ligaments, the nerves in the whole body, where the philosophy of chiropractic comes from you get manipulated in your spine and it helps the nervous system just control itself and heal itself, which there's truth to that. And lots of times that happens. It's like the very first chiropractic adjustment was it helped someone's hearing loss because of C1 was shifted enough that it was causing a lot of irritation and clogged nervous system flow to the ears, and with manipulation they were able to hear again, which was amazing. And I've seen crazy things in my career that it really does do that. Ringing in the ears for years that just goes away after an adjustment or two.
And so just the decision to go to Peru, let's just take a step back here if we can. You grew up in a suburb of Vancouver. You had this experience in high school where you worked with a physical therapist and then later shadowed a chiropractor. You made a decision fresh out of chiropractic school to go to Peru. Why Peru?
It was that experience at first. It was a righteous experience. I wanted to go there and bring what I think chiropractic should be there. Right. That was a long time ago, and I was 23 years old. I was righteous. I was dumb. I was young. And I was stupid. And if I look back at it, why the hell would anybody pack up, move to Peru, a country they have no idea about politically? They don't speak the language. They have nobody there that they know, no family, and just try to change the profession. That's righteous. That's stupid. But I don't give up. I just keep going. So what happened was I became quite successful there. I met the right people, and I treated the right people, and I got lots of people better, my style, my way, and I built 5 clinics there. Those 5 clinics then led to me bringing over Brazilian students, because there was a Brazil school there that was a sister school of my Portland school. So I brought over chiropractic schools that I brought over Brazilian chiropractic students and recent grads actually to help train them, teach them, learn them my style of chiropractic, or MSK style of chiropractic. That ended up actually turning into a clinic in Brazil. Met the right people, Dr. Ryan Culp in Peru actually, who currently is our COO and owner of Vida Integrated Health. Met him in Peru. We connected really well on philosophy. We actually then opened up a clinic in Spain. And this is mainly chiropractic and some physical therapy and some massage therapy, but mainly chiropractic clinics.
Those who are unfamiliar with chiropractic and have perhaps never seen a chiropractor, can you just define a little bit more about what manipulation is? And again, people think of like pop, but what is actually happening when someone's manipulated?
It's a great question. Manipulation is to the joints. People think the bone, but it's the joints. joints move, and sometimes they get stuck, or they're in the right range of motion, but they get stuck in that position, or they just don't get to that end range of that manipulation because muscles contract around there, scar tissue develops in that joint. So in the spine, there's a ton of different little joints. So chiropractors specialize in the spine because it's unique. It's little. There's little movements that can happen. And then when we create that sort of opening of that joint, so a joint is where two bones come together. So if we have two bones that come together, and when we open that joint up, remember that joint is surrounded by a capsule. So the capsule makes it an enclosed space so nothing can get into to irritate that joint. So when we actually create space in there, it creates a little bit of a vacuum. That vacuum just brings in the gases of the body, and that's what makes that popping sound. So that popping sound is just actually the joint actually sort of opening up and creating more movement in there. Then after you crack that, you actually get a little bit more movement and mobility in there. So the synovial fluid, which is a fluid in there, actually is able to lubricate that joint. We also stretch out ligaments. We also stretch out muscles, in those little teeny muscles that go from joint to joint in there, which then allows better movement and mobility in there.
I've never heard it described so well, I have to say. In my years of medical training, I've never heard it described so well of why you hear that pop or that crack. So thank you for that. It makes a lot of sense.
I think a lot of people try to dumb it down and just say it's a bone in a place, we put that bone back into place, which is not really the truth. The bone is not actually dislocated. In chiropractic, we use the word subluxation, which is a chiropractic term where it's just slightly out of a line. But the word comes from the subluxation complex, which a lot of people don't understand. This complex is not, it's movement, it's the nervous system and the local reflex system that around that nervous system. It's the muscle, it's the histology, the tissues around that area, and then it's the chemistry around that area, inflammation. So when we actually adjust, we're affecting all 5 of those components. Those 5 components is the key to manipulation. It's not just moving that bone and getting movement in there. It's actually allowing the nervous system to function properly around that area because of the proprioception of a joint. There's so much sensors in a joint to tell you where you are in space that when things aren't moving properly, those sensors aren't communicating with the brain properly, so then the muscles are not actually functioning properly around that area. So with manipulation, we're able to actually influence the local nervous system around it, then actually influences the central nervous system, how the brain's controlling all the muscles around that area.
I want to just understand a little bit about the Canadian healthcare system, your upbringing there. You mentioned again this experience. You chose to then establish Vida in the American healthcare system. So I'm curious, just in terms of that contrast, you've now worked in multiple countries. So just tell me about the decision to set up shop here in the United States, specifically in the Pacific Northwest, and how that decision came about.
Canada is the healthcare system is very limited. And when I say limited, slow, meaning I need an MRI, yeah, that'll get 6 months later, or because it's a non-urgent thing. So the healthcare system is great. They have all the pieces there, and it's social, so it doesn't cost you a cent for anything, which is amazing. However, to be able to practice there and use all the tools that we're learned and we've been educated on, you get handcuffed there because I need an MRI of this.
Clinically,
you get handcuffed. So I need an ultrasound. I need to see what's going on there. I need this referral. It takes forever to get that system going.
And our patients would probably say it takes a long time here.
Yeah.
But you're saying it can take months
3 to 6
years,
months to a year to get a surgery or an image or what we need. So for me, if you can start to understand my brain a little bit, I'm a little bit impatient. So that's what sort of kept me in the United States, is I really like the healthcare system here. If you can get what you want whenever you want it. Yeah, sometimes it costs a lot of money. Like healthcare is expensive here. It's probably the most expensive. It
is the most expensive. We know that, right?
Yeah. You got the best brains. You got the best docs. You have the best technologies. You have the access here that you can have.
If you can afford it.
If you can afford it. That's unfortunately the U.S. healthcare system. Yeah, there is a path that with Medicaid and Medicare that you can, and that takes a little bit longer. Not as long as Canada, but it's the same thing. It's the Medicaid. It's like Canada healthcare system, right? But with good insurances, good communities, you can have access to all these doctors that you need to have, and fairly quickly, which is great.
So that influenced your decision to move to the U.S. from Peru, correct? With a couple stops in between. You mentioned Spain and Brazil.
Yes. For being in Peru for a long time, it was time to leave Peru, come back to North America, and I actually got a call from a buddy, and he said, I need some help. And he was creating his first integrated health clinic in Bend, Oregon, actually. So I moved to Bend, Oregon, and that was with Mark Davies in Falling Waters in Bend, Oregon. And he was great. He was a nurse and a chiropractor, older than me, went to school with him, so we were good friends. And he just needed some help. So I went over there and helped him build his clinic. And that's where we had chiropractic, physical therapy, and nutrition and some functional medicine stuff there too. So that was my introduction. Mark taught me a lot about, as a chiropractor, nurse, he taught me a lot about functional medicine. I call it limited or first line functional medicine because it was very superficial, like really the basic stuff, right? The basic stuff that like vitamin D, hormones, DHEA, anti-inflammatory diets and all that. And actually I was like, wow, this is great, because by just using an anti-inflammatory diet was one of my main tools. I was getting way better results just by getting that information.
Using the anti-inflammatory diet.
Using the anti-inflammatory diet, getting the proper supplements like a vitamin D if they had deficiencies. So that's when I started ordering some labs and stuff like that. So that was my sort of intro to functional medicine and this integrated health clinic there. However, it was time to leave Bend. That I lasted about a year, a little over a year maybe. But in that whole meantime, the last 6 months, I was looking for a place in Seattle. Why Seattle? I think I always thought I'd live in Seattle. As a kid, I grew up coming down to Mariners games, going to the Sonics games. I love the vibrancy of the city. Every time I'm driving on I-5 past Lake Union into the city, I just had this energy sensation. I still get it every time I go through there.
When you're crawling on I-5, you mean? Is that what you mean? Okay, I just want to be clear.
But it's just coming into the city. I just feel that energy. And Seattle's super special. It's low-key in city aspects compared to a 9 million Lima craziness, but with brilliant people all over and brilliant things happening around here. So I just felt like I needed to be here. So I was looking for a chiropractic clinic to buy and purchase, and I found one in the Madison Park area and purchased that clinic and moved into it and started the journey. When I say started the journey, we called it functional health at first because that's how I thought. Not the greatest branding name by any means, but we called it functional health, chiropractic and massage. And that's what it was at first, chiropractic and massage. That was a small chiropractic clinic with 2 or 3 massage therapists and another chiropractor that I had with me. But I took over that to have a spot with the vision of just starting to understand, build the business to create an integrated health clinic. So of course, I always think it's going to take me 6 months and then I'll move into a bigger space and have this all thing. And then 3 years later, actually, 3 years later, it took me 3 years to get to what we now call Vida Integrated Health. And we opened up our first clinic just up the street where it currently is on Madison, Capitol Hill. And that was our first clinic. And that's when we launched the new brand, Vida Integrated Health. And why Vida? Yeah. Vida means life in Spanish. I bounced a whole bunch of different names around, but my clinics in Peru, which still exist, and now we have clinics in Peru, Brazil, and Colombia, and they're called Quiero Vida, which is a play on words a little bit. Quiero in Spanish means I want, and Vida means life, so it's I want life, but also chiropractic in Spanish is chiropractica. So that's where Chiro Vida came from. So Vida just seemed like Vida Integrated Health, and we haven't changed our logo since the beginning. It's just stuck with us for a while.
So for people who are now familiar with kind of the Vida clinic system in the greater Seattle area, you have 6 clinics, correct? I am also part of the Vida system, so I should say part of that is inclusive. One of the things that people don't know about you is you were like doing from front desk work to answering phones to treating patients right from the get-go.
Yeah, I worked Monday through Saturday. So as a small business owner, you are the garbage cleaner, the front desk scheduler, you're the maintenance person, you're the chiropractor, you're the assistant, you're everything.
What is Vida like now for those who are not familiar, and how did it get there? Where do you want to see it go?
Yeah, good question. It's because I don't really think, like I say, it's only getting to that 3-mile mark. I'm not a planner, if you guys didn't know that out there. Some of that know me well, like yourself, know that I don't plan very well. But I have my next vision, my next stop. When I started Vida and Vida Integrated Health, I thought, great. I've got my clinic. This is it. This is how it is. And it was like, let's get functional medicine, chiropractic, physical therapy, acupuncture, and massage all in one place, all encompassing. It's the community neighborhood clinic. This is where I am to stay, and we'll just embed ourselves in the community. However, that was super successful and fairly quickly. So that's why we jumped from one clinic to the next clinic. That's when I called Ryan, who we had a practice together in Spain, and just outside of Barcelona in Terrazas. And I said, hey, bud, I need some help. So that's when I brought him over, and we opened up our second clinic in Everett. We decided to close that down in Spain because it was time to come back home for him as well. He's also Canadian from Calgary, but he came over and we opened up our second clinic with him there. Thought, okay, 2 clinics, great. That went to 3, that went to 4, that went to 5, now we're at 6. And we just have something that our last clinic we opened from scratch with, and it's been in Renton, and it was so successful. It like the community was waiting for us. We just have something really special to offer that isn't around, which is great. And that's that team approach to care, where people come in for massage, acupuncture, chiropractic, functional medicine, or physical therapy, but they find their team, which is the coolest thing. Is then now it's, oh wait, I need this. See the acupuncture, so they can help you with that. We all work together to get all the basics and all the advanced testing, but most importantly is like we connect with everybody else outside the community, outside of our clinic, with like orthopedics or surgeons or cardiologists, specialists. We will connect you to those people. We just have that network now of community great people, which also refer to us and we refer to them, and we should be our first stop. And why I say that is, if you come to us, we can tell you right away if this is serious or not serious. Do you need a referral, or do you not need a referral outside, or do you need to go to the hospital? If we can manage something quickly, get you on the right track right away, symptoms go away quickly. The issues don't become massive issues. If we catch it early, it's easier. Or when I say catch it early, it doesn't mean that it's progressed, but like acute low back pain. If we can get our hands on it that day or 2 days later, it resolves quickly. If you think it's going to go away in 3 days and it doesn't, and now it's 2 weeks down, now you're waiting a week and a half to get to see a specialist or your primary care doc, and it's 3 weeks down the road, things have settled in. Muscle spasms have settled in, scar tissue is starting, atrophy is starting, joints are getting jammed up. Now your whole body starts.
Not to mention lack of sleep or loss of sleep because of that.
Irritations. Yeah. So there's so many cascade of events that happen there. So that's by being we like to say neighborhood clinic or community clinic. I like to say neighborhood clinic. Give us a call first. We'll get you in. We'll squeeze you in somewhere. We'll figure out what your next step is. And that might not be a chiropractic manipulation because it's too difficult at that moment, but it'll be maybe laser to help calm that inflammation down, and some proper stretches and exercises that just get you moving. Those could be the first thing for the MSK.
So your magic formula, I think you just said this in so many words, is the team approach. Like, if somebody asks you, like, what is your magic formula and why have you been so successful, particularly in the greater Seattle area, you would say the team approach, if I'm hearing you correctly.
Correct. It's the team approach.
You and I met each other in 2018. 10 years later, after you had transitioned from Bend, and you were so passionate when we first met about really expanding into functional medicine. At that point, you had some naturopathic physicians, but you were so passionate about wanting to really build out the functional medicine part of the practice. Why was that so important to you to, in addition to what you already had at that time, why was that the right moment?
Functional medicine it takes someone that really understands it, is smart, and is up to standards of the research. When I say research and studies and how it's progressing, because you can dabble in functional medicine, but you're not getting to the systematic biological approach. That root cause is really about looking at every component of it, not just looking at the cardiovascular system and the slightly related stuff. It's really about looking at that whole person. And when I say the whole person, I'm talking the heart, the circulatory system, hormones, sexual hormones, the brain, the gut, the immune system. Yeah. All these components are so important. And if people just dabble in that, they're going to miss something. If you took it, and when I say you miss something, you might not die, there might not be a red flag, but there could be something might be happening here. Or a genetic trend that, like, hey, you got to change the way you eat because you've got these genes. And if we can find those early, treat those and adapt to those early, and give people the right instructions, we're going to create a thriving community out there that's healthy. And that's functional medicine. I think it's a very powerful tool. We've developed and created, at that time that you came on in 2018, we had the MSK thing down. We were really good at pain, muscle pain, back pain, foot pain, ankle pain, rehabilitation after surgery, exercise. We had it dialed. We had our system dialed in there. Just that primary care was missing. Like, when I say primary care, that deep dive functional medicine approach that we look at as a chiropractic, physical therapist, acupuncturist, massage therapist, we look at all components of that person.
Because a lot of people wouldn't define functional medicine as primary care. So maybe we can just dive into that a little bit. You and I had these conversations, so I could speak a little bit about this, but we decided we had to bring in functional medicine primary care. Perhaps you could just explain your logic as the CEO and why you were really willing to embrace that concept, which is something that I think has been so critical for the growth of the department.
Practicing functional medicine is hard because you're looking at everything and you have to know everything to be involved. A lot of functional medicine specialists specialize in one thing, guts or women's health. That's it. So they're going to be missing other components possibly in there. So when we talk about primary care, it's like it's all encompassing. You have to really understand the psychology of this patient, their whole history. So it's hard not to be a really good functional medicine specialist, I think, in my opinion, without being their primary care physician.
Or having a background potentially in really understanding those internal systems. And I think for some of my colleagues who have chosen to do more specialty functional medicine, I think they can do it really well, but they've got to have that team player who's the primary care physician who really has those basics dialed in. And I think that it's challenging certainly for everybody in medicine to do primary care. But as a business decision, right? primary care is no small feat. It requires a lot of support staff. It requires people to be available. It requires appointments to be available same day.
We're your neighborhood clinic. That's who we are. That's what we're all about. And the team approach is not something I created. This is in every single locker room of every single sports team. Who's the head doctor of the team? Everybody thinks it's an orthopedist. It's not an orthopedist. It's the sports medicine doc, who is a primary care doc for the athlete. So that's flus, that's coughs, that's colds, that's everything. And that doc takes care of all those athletes. But then they have the orthopedist, they have their ATC, who the ATC is actually the quarterback of that whole team, telling when the orthopedic is needed, when the chiropractic is needed, when the physical therapist is needed, when the massage is needed. But the primary care doc is overviewing everything.
Wow.
That's the whole concept of where Vida has come from. It's like they got awesome care in that room. They've got all these docs looking at you, and that's how I would want to be treated. So that's what we are bringing into these communities in our neighborhoods is this is your team. We've got the primary care doc for you, the function, but that primary care doc is diving deep. They're looking at all the organ systems of your body. And then we have all the other specialists as they're needed. Chiropractic, physical therapy, everything to keep you going in your life. That's our model. That's who we are.
And you and I have discussed countless times the importance of movement. And so the fact that we have such a big emphasis and focus on musculoskeletal medicine and that we are able to keep people mobile, whereas like you just identified with the lower back pain case, they might be completely sedentary for 4+ weeks if they aren't able to access care quickly and efficiently and really get things moving appropriately. I'd love if you're willing to share some about your functional medicine journey as a patient, what you have learned, how you think functional medicine has shaped you at this stage in your life, and what you've learned potentially about genetics and other things. So put you on the spot here.
That's a tough question, of course, just because I've learned so much and I feel like I'm just learning who I am and how my body works. Functional medicine really is lifestyle medicine at the base, right? So lifestyle medicine being exercise, sleep, nutrition, stress management, and meaningful relationships. That's the key. Yeah. Exercise is part of that key. If we can, and they're trying, they might come up with this pill that can just mimic exercise and a lot of things won't happen again. That's the baseline, those 5 components. And I think we all chase that secret thing up here, that supplement that's going to help you out, this new thing, this GLP-1 or this new drug, rapamycin, that's going to keep us young. Yeah, there's some cool, great research on it. I've read it all, and I've looked at it all and seen it out there. I've dabbled in it all. And it's really good as long as it's landing on the foundation. So without the foundation is the key. So we spent many years with that foundation, which is getting you movement, getting you out of pain, getting you active, and that gets you back on the tennis court, that gets you back on the soccer pitch, that gets you back into your community. That's that meaningful relationship component of things. Yeah, we've been talking about nutrition and staying healthy and anti-inflammatory diets and all that great stuff.
Or just keep walking with your dog.
Keep walking with your dog. Keep playing with your grandchildren. Like, whatever it is. Right. We just want to keep you active, keep you doing the things that you want to do, thriving in your community, in your life. But then the functional medicine component adds on top of that, where you can take, the medicine is going so quick right now, and the diagnostics is the key. When I say diagnostics, it's like knowing how you're made up. Nobody knows how they're made up. What are your genes? What are your genes saying to you, the rest of your body? So if you've got bad genes, that can influence how your body reacts to a chicken sandwich.
Absolutely.
Fried food. Completely different than someone that has really good genes, has a beer, 2 beers, they're fine. Someone that has bad genes drinks a couple bit, they might not be fine. They might cause a massive inflammatory approach in their body. So knowing your genes, I think, is such an important component of things. Their gut as well, which then starts to influence how your mind works, everything in your body. And I think there's a lot of new research coming out with the microbiome and how that's influencing everything. GLP-1s, what's that affect? Your gut. And look at what's happening to the brain. People are getting off of addictions because of taking GLP-1s, which is so crazy. That's the gut. That's huge stuff. So as we dive into this a little bit more, we're going to have lots of stuff to learn. Having someone, a functional med doc that really understands all this stuff, can help you put your...
Can I pause you there?
Yeah.
A criticism of functional medicine, and I want to talk about why, again, mutually we've decided to do this concierge model, but a criticism of functional medicine is that it's only medicine for the rich. I've been in this space for 10 years. You've been in this space going on 20. That's a criticism because the diagnostic markers you just talked about, they cost money. Yeah. They're not covered by most insurance companies. And there are many that will say they're unnecessary.
Yeah.
So I'm curious. I have my own thoughts, but I'm curious, like, what do you say to that?
So my thoughts, it's their choice. Like, it's a discussion to have with your provider, with your doc. But remember we talked about the foundations of functional medicine: exercise, sleep, nutrition, connectivity with people. Like, those don't cost any money.
Correct.
Those will solve 80% of the issues out there, for sure.
They cost time.
They cost time. They cost a lot of time and a lot of effort. Trust me, I struggle my ass off with this stuff.
I know.
It takes a lot of time, but that's simple. These other things that we're talking about, like your genetics, getting your genetics tested and understanding, that gives you leverage to actually do this thing. Knowing your blood markers gives you leverage to stop drinking, for example. And I'm talking about this as a personal experience. Is like, I've had my genetics tested. I don't got great genetics in any which way, form at all. I've got high cholesterol because of my genetics. I've got a gene ApoE3, 4, which if you guys don't know out there, it's obviously, but ApoE4 is like an association with Alzheimer's. But any association is a gene tendency you have that can be influenced by your environment, being your nutrition, your exercise, what you do, what you take in, what you take out, your lifestyle.
Exactly.
If I needed, I'm good at exercise. I'm great at nutrition. I'm good at nutrition. I was good at all of it. I was active, fit, and if you were my patient and you know who I am, you think, oh, he's the healthiest person around, or one of the healthiest people I know. But I'm not inside because of my genetics. I had to dial my exercise, nutrition, everything to influence my genes to get my markers at the proper levels, which I check my markers 3 times a year because I'm monitoring, I'm influencing, and they're not all perfect ever. I'm working on getting them better and better, but that takes time and takes effort, and I mess up. I don't sleep well. I have a high stress level as 140 plus employees, so I have to monitor things. I've got family, I've got stress, I've got all these things. I like food. I love great food. I loved my wine before, but it's like something that I had to cut out of my life, and I feel better for it. Yeah.
I think what I would interpret from what you said was you can just do the foundations. It's a mutual conversation between your provider and the patient of, hey, we can do these foundations, and those don't cost anything. Time is definitely something we could talk about endlessly. But I do think that there are then picking and choosing, perhaps, is what you're saying about what type of diagnostics you use. So I'd like for you to maybe just talk about with this concierge model. And number one, in the American healthcare system, as it is right now, insurance reimbursements are going down. We do primary care, functional medicine. Why was it appropriate in 2023 for us to move to this concierge model? Because that is only amplifying this kind of concept that functional medicine is inaccessible to all. So if you could speak to that.
Great question. And this was something that we debated for a long time. Big philosophy of ours is bringing healthcare to our community, to our neighborhoods, right? So that means keeping it economical for everybody. However, when you can't deliver the care that you need and want to give someone, then we're cutting corners. And we can't do that. That's not the right way for care. So when we get into functional medicine, where the system of payment for insurance reimbursements and for functional medicine is based on conventional medicine, which, as you see your primary care, it's 10 minutes in and out, and they look at one thing and they're done until your next appointment. We tried that model. We tried to keep it at this just insurance model, and we had burnout everywhere. We had burnout of the docs. We had burnout of the patients, because we just weren't able to give them what they needed and how they needed it and the education they needed it.
And the type of medicine we were so passionate about.
Type of medicine that we're so passionate about. We were trying to do it with 30-minute consultations, which is a long time, but we had to move them to 60 to 45 minutes to 60-minute consultations to get into the weeds, I should say, to understand that person from the basics. So we had to make that decision to go concierge, to allow for the docs, our functional medicine doctors, to dive deep into that person and learn that person really well without having to turn and burn and see a lot of different patients.
Did that hurt your heart?
It was a struggle at first. Like I was combative at first. I didn't want to do it, but then I did want to do it. Then it was the burnout. It was the burnout of the docs. It was like they're burning out. They can't do this. We've got waiting lists everywhere. This is not sustainable. It's either we're going to crash, we're going to shut it down, functional medicine completely down and go completely cash-based, or we've got to try to figure out a hybrid model. And which we were able to figure out a hybrid model, and we try to keep the concierge fees low to a monthly gym membership type price to allow for that communication. In functional medicine, you're communicating with your doc a lot. It's not just your yearly checkup. We're there to answer those questions for them, because it's our patient now. It's our community. It's our way of actually really helping that person thrive. Yeah. And that takes a lot of effort.
It's a partner.
It's a partner. And we're there for you. That's how we are. Obviously not 24/7, because that would make anybody go crazy. But we've got a great system that allows us to answer those questions and get those answers and follow up with patients on a regular basis, rather than 2-3 times a year.
I asked you why, if it hurts your heart, because I did a podcast with Jeff Land and James Maskell. The conversation was around, can you do functional medicine on an insurance model? And I was bright-eyed and bushy-tailed at that moment in my career, 5 years out of school, and we were doing the Vida Functional Medicine program together, and we were busy. We were really busy. But I look back on that conversation and where I sat on that part of the table advocating that we keep things in an insurance model, not fully understanding the economics of it. And I think you, being the CEO and kind of business mind behind the Vida system, really had to look at, how do we make sure that this is sustainable and we can keep the lights on? Yeah. And keep our doctors from just going flatline. So I think there could be a little bit of a misconception that the concierge model was intended just to be strictly for financial gain. And I think I want to ensure, not only from a patient perspective, but also from our team, because it was hard for our adjunctive team members, our chiropractors, our physical therapists, our massage therapists, to understand, like, why were we doing this in the functional medicine department? Is there really wasn't a whole lot of other options other than compromising care, which for you and I wasn't an option. There really wasn't another option. And we're fortunate that we have been able to keep the non-concierge insurance-only realm of our practice through our residency program. So I think it's important to acknowledge that this is a new platform. Concierge medicine is still relatively new in our area. People don't fully understand health insurance and how physicians, providers are impacted by diminishing reimbursement rates. I'd love for you to just share kind of your assessment of the current American healthcare system. I know that's like a 3-hour conversation at minimum, but where are we in the American healthcare system? Where does functional medicine fit in? Where does precision medicine, some of these synonyms, how can we utilize this drive to reach for longevity medicine? Where are we?
We're in a society of social media and influencers who are out there everywhere talking about everything, and they're now becoming the experts. And what's happening is they're influencing people into trying different things and without a real plan. So then they come to the doctor and they go to their primary care and ask, okay, how about taking this or this? And primary care clashes with them because it's not in their realm of social media. So I think the population, the communities, our neighbors, have a lot more information about things. So they're semi-educated. I say semi-educated because they've read a podcast, they've seen a podcast, they've done, but it's about the deep dive and understanding how whatever they're talking about influences everything else in their bodies. And just because it's really good for this person here and it's really helped this person here doesn't mean it helps this person over here. It's an individual. And that's where a good functional medicine doc is able to see that this is an individual, what's going to work for this individual. Community health is different. It's about what does the research say is the best thing for the community.
Public health, yeah.
Public health. And that's a different style of medicine. And that's great because it helps a lot of people, but everybody's an individual. So to optimize, you need someone that really understands all you. In today's society, I think people are looking for that now. And that's the hard part. They're going to their primary care, and the primary care, there's not much education on that. I don't know much about that. So I think...
Or at worst, they're dismissing something that...
Or dismissing.
Something that they just don't know anything about as non-evidence-based, when in fact there is often evidence. Yeah. They're just not necessarily familiar with it. Yeah. So
exactly. I think that's it. But I think the future of medicine is really individual care. It's about that person in the center with their team around them.
I really want for our audience to understand, like, who are we trying to help? And I have my perspective on this, and it sounds like you're talking about those who really want to be engaged in the lifestyle pieces, who are ready to engage in the lifestyle pieces. Because if you're not ready to do the foundations, which you can do before you come to us, right?
Yeah.
But if you're not ready to do the foundations, it may not be, you're not going to get as much out of the kind of total package that functional medicine offers. Is that what you're saying? I don't want to...
Not really.
Okay.
What I'm trying to say is knowledge and understanding can be the leverage that gets you to focus on those foundations. Okay. So if you figure out that your cholesterol is sky high or your blood pressure is sky high, which you don't feel, by the way, you don't feel sick. Correct. You don't feel like you have high blood pressure, but these are silent killers. They're killing you. They're clogging your arteries. They're destroying your arteries that go to your heart, go to your brain. So those set you up for dementia. They set you up for heart disease and cardiovascular disease. But you can live till you're 60 without having a clue or a single symptom until it's almost too late. So that average person that is not studying this or looking at this like me or obsessed with this like myself, it's about them getting interested in it, getting a consult, understanding, everybody should understand their markers. And those are basic blood tests we can do. Correct. It's not a big thing. Once you have those, then it's not be like, oh, my cholesterol's a little bit high. No, your cholesterol is high. There's no such thing as a little bit high. These are causing damage. It might not be causing damage as someone that has cholesterol twice as much as you, but it is causing damage. Do something about it.
Yeah, and when you then layer on just my medical editorial here, is cholesterol is debated in this field. Is it the demon that it deserves, or is it really just this innocent bystander? And I think we have to look at it in a combination of inflammatory markers, blood sugar, blood pressure, genetics, which specific lipoproteins, which is a specific type of marker that we can measure, are elevated or not. All of those things can contribute. And so how often we hear patients come in and say, oh, my total cholesterol is above 200, which is what the lab reference range is. I say to my patients all the time, I don't care what your total cholesterol is at all. Yeah. What I care about are all these other markers, specifically if we're thinking about a standard lipid panel and LDL. So sorry to add additional information, but to your point, it's education.
Yeah, it's education, but that's where like sometimes it's worth investing in the diagnostics. And if you do have high cholesterol, then likely your insurance will pay for a diagnostic test of your arteries, for example, where they can look at the plaque in your arteries. How much plaque do you have in your arteries? How much hard plaque? How much soft plaque? Right? Because that's a leverage there. Someone all of a sudden says, oh, I've got high cholesterol. It's in the normal. It's a little bit high. Then they get an ultrasound of their carotid artery and they see that actually there's plaque in there and it's 30% closed. Hey, shit's happening inside. Meaning that's leverage. That now changes who you are. The treatment. And the treatment. It changes the treatment too. But that makes you go, oh, shoot. I got to really look at this. I got to really understand how I bring this down. Why? I want to play with my grandkids. I want to be there when my grandkids graduate from high school. Yeah. I want to see my grandkids excel in life. Yeah. Like, those are some special moments for sure. And I think, like, medicine now and the knowledge that we have out there now of the body and the diagnostics that we have and the new drugs and AI and how much quicker we can understand things. Absolutely. Any patient can have another 10 years, easy. Another 10, not just 10 years of life, but a 10 years of active, functioning, healthy life. It's really easy to get to that 10 years.
Yeah, because that 10 year of actual chronological extension is tricky. But I think what you're talking about is really how can they live what, I'll just say his name here, Peter Attia, and he talks about this like kind of golden decade. Yeah. Your last 10 years of life, whenever that is we want it to be robustly active. We want you to be engaged. We want you to be cognitively intact. We want you to be feeling good during those years. It's not that we want you to just be going doctor appointment to doctor appointment. Exactly. So in terms of greatest challenges with Vida, what have been some of your greatest challenges? What are some roadblocks? You could, if you think it's relevant, bring in the COVID conversation, but where have you seen the growth?
Yeah, the biggest challenge is good people. People that fit the culture of who we are, especially in the worlds that we are. We've got a bunch of disciplines, a bunch of different educated healthcare providers from different realms of healthcare, right? From functional medicine, naturopathic medicine, acupuncturists, chiropractics, physical therapists. And all of these people are usually treating on a silo, meaning it's their chiropractic clinic. They're trained to be treating by themselves. So if you don't have someone that really understands that team approach and where they fit into that team approach and how they can communicate well amongst their team of approach and have no egos, that's the key. once you find the people that don't have the egos and is just looking out for the best of that patient, whether it's physical therapy or chiropractic or acupuncture or functional medicine or massage, and we can all talk about what the best approach is and how each of us can contribute, that's golden. It's hard to find those people. Everybody has egos. Everybody's trained differently. Everybody's been told that, like, a physical therapist should not be working with a chiropractor, or a chiropractor should not be working with a physical therapist, or an acupuncturist. What the hell are they doing? They don't know anything. Or a naturopath. They aren't conventionally trained. Where an MD goes, I know everything. It's that where there's no egos is the key to our people selection. And they need to know their craft, and they need to know their limitations so that everybody can work together.
140 people, no egos.
Yeah.
That would be an incredible feat.
It's hard.
Yeah.
It's hard.
And just to plug him, credit to Ryan Culp, who has been instrumental in kind of the behind the scenes development of Vida and some of the important systems behind it. I think.
Yeah, we would not be alive if it wasn't for him. I'm chaos and visionary, and he picks up the pieces and organizes them.
Yeah. Do you see yourself as a visionary?
I'm a dreamer. I don't know about visionary, but I dream, I come up with things, and I'm like, it has to be this way, and I'm stubborn. And I don't give up. So it's just...
I do know that about you.
Yeah. So it's just about, if I have a unicorn in mind, I'm going to find that unicorn. That's how I am. And I'm going to fail, and I'm going to bring in the wrong person, but then I'll adapt. Finding the right functional med doc was a really difficult thing until you came along. Like, I went through a number of different docs before we found that right person that really understood the whole realm of aspects.
Where do you see Vida going from here? Talk to me about your vision for the future.
So my 3 mile future is we're expanding our Kirkland clinic to expand our functional medicine offerings, really focusing on precision longevity medicine, and just adding a few more diagnostic tests, such as a DEXA scan, in-house DEXA scans, where we can understand someone that has a weight issue, and if they're taking a GLP-1 or prescribed a GLP-1, we can make sure that their muscle mass stays.
I just want to, we haven't defined DEXA and we haven't defined GLP-1. So just so we can make sure that anyone who's listening to this doesn't get confused on what we're talking about.
If anybody out there that has not heard of GLP-1, it's everywhere out there, commonly known as Ozempic or Mounjaro or those things. But a DEXA scan is basically a scanner, X-ray. We use X-ray to look at the body and look at the composition of the body. How much fat, how much muscle, how much visceral is there, and we can measure that over time and see how that changes over time.
Historically, bone density.
And bone density, of course. So those are really important things rather than just looking at the scale, because we could look at a scale and see us losing weight. But we want it to be the right weight. We want it to be the fat, or even better, the visceral fat. And where is that fat? Like, the DEXA scan will help us define where is that fat. Is it visceral? Is it elsewhere? Visceral meaning around your organs, smothering your organs, strangling your organs. I'm not overweight. I'm fairly fit. But any fat I get, it goes right to my viscera. And it really affects how my organs function.
And you know that because you have done serial DEXA scan monitoring.
I've done DEXA scan monitoring, I've done MRI monitoring, I've done scanograms of my liver, and all those things. Like, I've tried all. Yeah, I tried all out to figure out what's needed, and it's amazing. Like, I've had liver disease. Like, it's been fibrotic liver disease in my body. Sorry. So I wouldn't have found that because I'm not overweight. I'm fit. Yeah. But I heard about a fiber scan. Oh, my liver enzymes were slightly high for some odd reason. So it was about having that done, which then found grade 2 advancing to cirrhotic liver disease. And that's serious, right? That's life-changing. That's future liver transplantation thing. So that's when That was my major leverage in my recent health switch. Obviously, haven't touched alcohol since. Have a drink here and there, like a wine or a beer or something like that. But it's about me not being overweight, but taking a GLP-1 just because of the antifibrotic process of the liver. It's me taking liver enzymes. It's me changing my exercise. I used to be a sprinter. Now I'm a long cardio guy. I do zone 2 for a million hours a week just to change that body. It's nutrition. Changing how I eat. Way less red meat. Way more vegetables. It's really about me dialing in.
So you want to bring a version of this experience, this transformational, obviously emotional experience that you've had with your own health journey. You want to bring that to others to be able to experience that.
100%. That's what it's all about. It's about, wow, I just saved my liver. I just saved my life with this diagnostic testing that no one would ever say I would need that by looking at me or even looking at my blood levels. Like maybe there's a little suggestion of something going on, but if we can save one person's life, it's worth it.
Yeah, absolutely.
And so if we can have this testing for everybody at a convenience of our neighborhood clinics, hell yeah, let's do it. And let's try to educate people in the value of this. Like that, huge. Instead of having that, like you can't go out for dinner with your family for under $300 nowadays if you have a 5-person family. Jump in, get some testing. Yeah. It's way better for your family than anything else.
Do you think that in terms of this longevity trend, this longevity moment, we've talked a lot peripherally about the types of things that are in the longevity space, at least I define them. Cardiovascular disease prevention, I think, is longevity medicine. For example, making sure immune health is as optimal as it can be is longevity medicine, because we know there's a close relationship with prevention of disease, all sorts of disease. What do you think about longevity medicine? You're starting this new center. You're investing heavily into some of these technologies that fit into this longevity sphere. Do you think it's a trend? Do you think it's just a buzzword? How do you define it?
That's a great question, because the longevity out there now is going crazy. The word longevity is everywhere. I was into it. Like I loved it. But now it's like everything's longevity. But I want to look at it, instead of longevity, it's like true individual care medicine. It's about understanding your body, where it's at, and then optimizing each component of that. There's these biomarkers out there, there's these biological ages now, and like everybody is saying they're 32 years old now and they're 50 actually chronologically. But you're only as young as your oldest component of your body, your oldest organ. So you have to find the one that's not so good and really focus on that for a while. So that's what's going to keep you going. And that's hard to do by yourself. And that's hard to do with sprinkles. When I say sprinkles, it's like the foundation is the foundation. Without the foundation, all this extra stuff, this supplement, these cold plunges, these saunas, this GLP-1, this red light therapy, this rapamycin, all that is not going to do much if you don't have the foundations. So it's about building that up. And then if you're interested in, and you're talking to your doc and there's a reason why, then you can add on some of these advanced stuff in there as well. So I look at longevity not as longevity, like staying healthy longer, is about optimizing your individual biology. That's really what it is. And you can't, I've got all the access out there and I've been working on this for a long time. I'm not close to it yet because it's really hard. I'm constantly tweaking and I do too much of this, I do too less of this, and it's just about finding that. But each year I'm getting closer to it, to dialing it in, and that's part of it. It's part of who it is. And if you monitor it, you can see trends quickly. You can see what you do now, check it later. Was it working? No, change your strategy, check it again. That's what I think of as longevity medicine, is really about individual health.
Yeah, and you've brought up a few times how it's really important for the provider to understand the psychology around their patient. And obviously there's not a biomarker that we can measure psychology. And I think I would be remiss if I didn't emphasize the importance of mental health and just emphasizing how critical it is that someone is working on their own sense of calm, what kind of brings them back to center, because we could have all the biomarkers in the world, and that can sometimes aggravate anxiety.
Yeah.
It can propagate some of our own pathology that we're trying to prevent.
Yeah.
So having that relationship and understanding and connection and making sure that we're understanding that there are things that are not measurable, at least not yet.
Yeah.
And I'm sure, as I know you and I have talked about, you agree, but just how that fits into the longevity space, how that fits into quality of life.
Yeah, mindset's everything. It's everything. And understanding how your brain works, why it thinks a certain way, why it reacts a certain way.
Yeah.
It's hard. It's hard to figure that out. And you can't do it by yourself. So I honestly think that everybody should have their therapist that helps them understand their own brain, because your brain influences your entire body.
Physiology.
So the anxiety, the stress, that will increase your blood markers in a bad way. So that's part of this whole thing approach.
What tools have you used?
Meditation is one of the top ones for me. It's really allowed me to calm me down. Obviously, high stress world, meditation really helps me out. Exercise, of course, but I have my therapist. I go to him all the time. He's been great. I'm new to it the last couple of years of going to therapy, and it's a game changer. I'm like, how do I get my kids into this now when they're only teenagers? But if they can learn that now, life's just going to be so much better as they go forward, being able to understand why they do things and how they react, and then tools to help change that programming.
You've described for me previously your visualization of a perfect day and some of the tools that you've used around gratitude. Because if we wake up in the morning and we think about what we don't have, or we think about what we want, but we're very far from achieving or obtaining, it does change your mindset. It does change kind of your way that you flow through the day. Can you just talk about, you practiced for 23 years, something like that, in chiropractic. You ran a business, you had young children. Like, how does that visualization work for you as a CEO, as a father, as an individual, as a partner?
Yeah, I look at it as like foreshadowing. And when I say foreshadowing, if you start your day in a relaxed state, looking at, okay, I want it to go this way. This is what I'm going to do. This is how I'm going to feel. This is the goals that I want to reach to. If I can set that up at the beginning of the day, it's so much easier to go through the day that way. If you don't, then everybody else is influencing how your day goes, and you're just being pulled in every which direction.
Ping pong ball.
But just bat it around. Ping pong ball seems too nice. I'm talking about a punching bag.
Yeah.
But that's it. If you can set your intentions, start your day with gratitude towards everything that you have, which is abundant. Like, we all have abundance in our lives, and there's abundance everywhere. If we can start our day that way, and then outline, okay, morning I'm going to do, this is what I'm going to do, this is how I'm going to feel, this is who I'm going to talk to, these are the people I want to reach out to, this is what I want to get done. That's the way to go. Everybody tries to do everything. You set up your 3 goals of the day, accomplish, great. Yeah. And those 3 goals of the day should be the 3 things that are going to move you forward the most. Yeah. Not 3 things that need to get done.
Yeah, absolutely.
Those will get done, but these 3 are what moves things forward, right?
I've really loved this conversation. Obviously, you and I have offline conversations all the time, but I love just hearing your story. There's probably 10 other hours worth of content that we could talk about, but we'll have to have you back. Thank you for being here today. Yes. And I just want to thank you for listening to our first episode of Vida Vitality, and we hope that you'll listen in on future episodes. We're excited to have other very notable guests coming up, and I hope to connect soon.